Welcome back, it's Dr. Somji. Today we're going to be talking about something that always trends on social media, dermaplaning. What is it? Does it make your hair grow back thicker? You're going to get a beard. And what are the things that you need to look out for? So we're going to tell you absolutely everything, so stay tuned. So dermaplaning involves taking a blade, normally a straight blade, and this is one that we use at the clinic. So this is our essentially a scalpel holder, and then you've got a number 14 blade. So this is a straight blade, and this is the type of blade that really you're going to be using for dermaplaning. Now, a lot of people think about dermaplaning and just think about the hair, this peach fuzz hair that you get. And yes, one of the aims is to remove that. But one of the reasons why we actually use dermaplaning, particularly in cosmetic dermatology patients, is for things like acne scarring, actinic keratoses, so things that might be, let's say, pre-malignant lesions, to obviously make sure that they don't build up. Also to help with the smoothness of the skin and increase the penetration of things like chemical peeling. So we commonly combine dermaplaning with chemical peeling, so it penetrates deeper into the dermis. And also just improving the overall texture and quality of the skin. So these are reasons why you would dermaplane in the first place. It's not always for the hair. Now, what does the procedure involve? Well, the first thing is that you're going to adequately cleanse the skin. So we cleanse the area. If you're doing this at home, you may want to make sure that you're double cleansing, i.e. that you're getting rid of all the natural oils that are within the skin, because this can make dermaplaning a little bit more difficult. I'm going to show you how to dermaplane on my hand, because it's a little bit difficult to start shaving my face without having a mirror to look into. But I'm going to tell you about the principles that you should be doing with dermaplaning. Look, the aim is really a light exfoliation of the skin, and the aim is to remove the dead skin layer. So that's what we call it's termed the horny layer of the skin. So it can allow more adequate penetration of active ingredients afterwards. So if you're doing it at home, you might want to use your favorite serum afterwards. Now, when you're doing it on the face, you always want to make sure that you have what I call counter tension. That's the most important thing for anything when you're doing anything like surgical on the face. If you're just going to leave your skin hanging and you're going to start doing this downward motion, you may drag on the skin. Even if this blade, like this blade, is a surgical blade, it's really sharp. You want to use counter traction, and that's with your non-dominant hand. So if I'm going to start on the cheek area, I'm going to basically do this, and you can see. So you're going to have that nice smoothness so that you don't drag on the skin, and there's very little chance of you cutting the skin. The most important thing when you're doing dermaplaning is that you only really go over each area twice, and that's enough, and it's safe so that you don't cut the skin or irritate the skin. And you always go in a downward fashion rather than against the grain of the hair. That's when you're going to get sometimes increased breakouts in the area. And if you've got active spots, you really don't want to be doing this. So look, if we're looking on my hand, and you'll be able to see, hopefully this can show in the picture, you can see I've got a little bit of hair on my hands, but look, the hair's going this way. So, I'm going to have my counter traction because I'm just making a fist, and this is the angle that I'm going to do. So this is a 45-degree angle. But look, yes, the hair's coming out, but if we can zoom in, so you can see that dead skin is building up onto my blade. And that's what you really want to be removing, is that dead skin. It's not always about the hairs. Now these are thicker hairs, these are terminal hairs. You can see that. And if I'm going to remove that on the face, they're going to grow back at an angle, and they're going to grow back thicker, and temporarily thicker. The actual shaft is not going to get thicker, but it may appear thicker. And that's why people say that when you shave those terminal hairs on the face, they may get a bit thicker. People say, well, if you get rid of those peach fuzz hair, you're going to grow a beard. Fact is, take it for someone that deals with hair on a daily basis, performs hair restoration, you're not going to get a beard from getting rid of those peach fuzz hairs. Actually, yes, temporarily, if you're going to cut those terminal hairs, which are thicker hairs, temporarily where you've cut it at an angle, it's going to appear thicker when it grows through the skin. But once it grows out again, it'll be at the same level as what it was before. So, now before, it's when babies are born, they say that you should shave the hair off and it'll grow back thicker. These are all, unfortunately, old wives' tales. It doesn't change what's going on. So, you know, when you shave the hair, it doesn't change too much. And like I said, with dermaplaning, there's patients that have been doing it for years and they don't have a beard. So you won't have a beard, basically. Now, who should not get dermaplaning? Well, patients that have active acne, have a lot of pigmentation in the skin, and have a lot of redness within the skin. These are patients that you have to be very, very careful, because you could get more acne, you get more congestion, so you really want to control the acne beforehand. Patients that are also on things that make your skin more sensitive, so things like antibiotics that might make your skin a bit more photosensitive. If you've just been in the sun, these are things that you really shouldn't be doing when you're dermaplaning. If you're dermaplaning at home, my recommendation is not to follow it with chemical peeling at home. There are some nice serums that you can use immediately after dermaplaning. So certain vitamin C serums are fantastic. The Skin Ceuticals, the ferulic, is fantastic. If you really have kind of like, let's say, skin that's a little bit more sensitive, maybe you just want to follow up with just hyaluronic acid, that's absolutely fine. It's not going to have any actives in there, but at least it's going to hydrate the skin a little bit more. How often should you do dermaplaning? Well, you should only really do dermaplaning once every 2 weeks. You shouldn't do anything more, because if you're constantly taking away that dead skin layer, you may be damaging the skin barrier, especially if you're not supplementing with things like glycerin and ceramides and barrier boosting ingredients afterwards. Do your dermaplaning, clean the skin twice at home, don't go against the grain, only 2 passes over each area, making sure that you're removing that dead skin layer. Don't go over active acne, don't go over things like moles as well. These are things that are too stimulant to the skin. Always ensure that you're putting hydration on after you have your dermaplaning treatment, and also don't use any actives on the same day that you do dermaplaning, and that includes things like retinols as well as AHAs and BHAs. As long as you do that and you do it once every couple of weeks, dermaplaning can be a nice little routine for you. Also, if you're buying non-disposable ones, these are disposable blades that you can throw away at each time, and I implore you guys to get that. You can buy these literally for next to nothing on Amazon. You can buy the blade holder, which is great, and then you can swap it with a new blade each time if you want to do that. You've got these fancy dermaplaning blades and stuff that you can buy from websites and stuff, and people say you can sterilize them and reuse them. Yeah, you can be bothered with that, but to be honest, I can't be bothered. I just use a new one each time, every couple of weeks. It's a lot cleaner, it's a lot safer, and also the blade remains sharp as well. So it means those 2 passes are really good passes, rather than having to do it like 3 or 4 times, which can increase the amount of irritation that you get. So if you have any more questions about dermaplaning, let me know in the comments below. If you think I've missed anything or you want to know a little bit more, let me know as well. Don't forget to subscribe to the channel, because you'll be the first to know once you hit that bell button when new videos come through.